What if you have a low AMH? Can you get pregnant? Hi everyone, I'm Dr. Shalini Singh. I'm laparoscopy and fertility specialist practicing at Lucknow. So many times when you go to any doctor for your fertility evaluation, one of the common tests that you're asked to get done is AMH. So I hope many of you have heard about this test AMH. So today I thought I'll discuss and talk more about AMH because once AMH is done and if it turns out to be low, many of you get worried that maybe you may not be able to conceive or you may need IVF or you may have donor oocytes. So today I would like to clarify your doubts that what if your AMH is low? Are you infertile? So basically AMH is a hormone. It is a blood test which is done to know your baseline fertility levels, your baseline ovarian reserve. And if AMH is low, that usually tells that it is a low ovarian reserve. But it does not mean that you are infertile or you cannot conceive by your own eggs or you cannot conceive spontaneously. See, AMH with aging, usually the egg counts of a female start decreasing, and along with the egg numbers, there is also a decline in the quality of egg because of stress and the lifestyle changes with aging. All these things affect the quality of eggs and also the number. So what happens? A female is born with around 1 million of eggs at birth. Initially, at birth, there are no hormonal control. The hormonal axis is not matured once a female baby is born. So what happens? These eggs are lost at an alarming rate, and by the age a female attains puberty, where the hormonal control from brain is activated, where the brain start controlling these eggs. Before puberty, there are large number of eggs which are lost, and by the age of puberty, female only have 350,000 egg left with her. Now after the hormonal axis or puberty, the brain start controlling these eggs, and now brain decides how many eggs are to be chosen or selected in every cycle. So these eggs are initially in condition called primordial follicles, and once the brain start controlling, they start maturing. So the primordial follicle become preantral follicle, then antral follicle. Now these antral follicles start secreting hormones called AMH, anti-Mullerian hormone. So if these antral follicles are less, AMH will be less, and if these antral follicles are more, so the AMH will be high, which is usually in PCOD patients. Or from number of egg, what is more important is a quality of egg, because in every month in a natural cycle there is single egg which ovulates, and you need a single good quality of egg for a spontaneous conception. So AMH along with antral follicle count, which is done by transvaginal sonography, is important or a better determinant for your ovarian reserve. So if your antral follicle count, which is done on day 2 or day 3 of menses, if the antral follicle count is less than 5, you say it is a poor ovarian reserve, and if it is 5 to 15, it is a normal ovarian reserve, and more than 15, it is said it is a high responder. So basically, AMH is done in patients who want to delay their pregnancy or they want to go for IVF, because in IVF we need large number of eggs. In normal cycles, we usually want a single good quality of egg. So AMH basically is a determinant that whether if your reserve is less or your AMH is less, you should not waste time. You should see your fertility specialist early, or you should go for preservation of your egg if you want to delay your conception. Even in case of IVF, we want large number of eggs, so we want AMH. AMH does not mean that you cannot conceive. It only determines whether you need early action or you need higher dose of medication for a good quality of egg. So even if your AMH is low and you are having regular menstrual cycle, you can conceive spontaneously. And only thing is, just stay healthy, eat healthy, keep yourself fit, and keep those limited number of eggs in a very good quality. So I hope I could clear your doubts, and I'll be happy to answer if you have any queries regarding low AMH, or if you're worried that your if your egg reserve is very less, or you are going for premature ovarian failure, then there are various treatment options like stem cells or the ovarian rejuvenation. Thank you.